What in Sam Hill is this? These are fat globules. This is a vessel wall. And we have some hematopoietic stem cells and some alveoli here on the outside. We have a bone marrow embolus in that slide. So fat embolism syndrome occurs in 1 to 3% of patients with long bone fractures, and it can be fatal. Within 24 to 72 hours of trauma, patients present with a triad of respiratory distress, neurological impairment, and a petechial rash. The underlying mechanism is going to be flat globules from the marrow that are entering into your bloodstream and then lodging in your pulmonary vasculature. Histology shows your fat and marrow elements obstructing microcirculation. So don't be fooled by similar presentations with like pulmonary embolisms or ARDS. Petechia and bone trauma point to your fat embolism. The petechia and the bone trauma, the long bone especially. So the correct answer is going to be long bone trauma. So here's our practice question. We got this person, 28, construction worker, falls from scaffolding and sustains a femoral shaft fracture. 2 days later, develops dyspnea, disorientation, and red spots in the chest. And unfortunately, this person is going to die, and pulmonary capillaries are going to be filled with lipid globules and bone marrow components. Which factor is most directly contributing? It's going to be their long bone trauma, right? Because you're releasing the fat into the bone marrow in the circulation. The fat obstructs the pulmonary capillaries, causing the systemic inflammation, producing the triad of respiratory distress, petechia, and neurological signs. It's not going to be like aspiration pneumonia. That'd be like, you'd see some like, I don't know, there'd be like something related to Klebsiella or an inspiration of foreign material. You'd see sepsis leading to ARDS. Well, ARDS would present similarly, but it doesn't have that petechia rash. Or you wouldn't see a marrow emboli like this. Heart failure, pulmonary congestion, and hemosiderin-laden macrophages would be present in your heart failure. So it's going to be like a day, 2-3 days after trauma, respiratory distress, neurological symptoms, and the petechia rash. So look out for those fat globules, bone marrow. See you guys in the next video.